This is Dana. We actually have a few questions. So this one
Awesome.
says, what types of questions should be asked of the examining or attending providers for them to confirm the person actually sustained a concussion without offending them? Since people can look up, symptoms on the internet and they can just say they have it even if they don't. So is there something that can be done to confirm if someone is dizzy or truly sensitive to light?
No. So good question. Yeah, and that's the problem that we have is that yes, I could Google concussion and then go in and say I have this, this, and this, and this. But that is a red flag sometimes when people have all of the symptoms. There's a symptom checklist they give people, and there's what 20, depending on which one you use, 21 to 24 symptoms. And when people have all of them, you're like, really? Okay. So that's always a red flag. But the
Mhm.
truth is, there is a component of the patient says they have this. I can't prove they have a headache or don't have a headache, right? But that's why when the symptoms persist, it's important to have them see somebody who's actually experiencing concussion, because I don't give people a checklist. I've never had them fill out a form. One, because I get really annoyed when they're still in the waiting room and I'm waiting for them. I run the clinic on time, and I don't like them still filling out forms. But I'm going to ask them the questions anyways, and I'm going to ask way more questions about those symptoms, right? Um, but also, in the acute setting, it's really important that they ask about what we call mental status changes. So what I always tell you people is we distinguish between a head injury and a brain injury. Okay, if I hit my head, that's a head injury, and that could be laceration or bump or whatever. If I hit my head, I'm going to have a headache. I hit my arm's going to hurt, right? Headache in and of itself is not a concussion. There has to be changes in how the brain is functioning. So what people feel when they have a concussion is they feel off, they feel confused, they feel disoriented, loopy, cloudy. I hear all kinds of goofy things. I felt like I was drunk and I hadn't been drinking, all these things. So again, it's those questions that, and particularly in a workers' comp, it's important not to ask leading questions, right? Were you dizzy? Yes. Were you nauseous? Yes. So you can't prove it, but you can ask these questions in a certain way to try to get to the validity of those. But it is true. It's kind of like back pain, right? There's people can report things, but I will also say too that there can be lots of inconsistencies. Like people will say, "I'm so dizzy," and then you ask them. I always say, "So you're not working? What do you do? What are you doing during the day?" And they tell you things, and you're like, well, "If you're dizzy, you couldn't do that, right?" Or surveillance. We see surveillance videos sometimes, and what you see them doing is entirely inconsistent with someone who's really dizzy or et cetera. So there are ways to get around it, but and I will say, listen, I always want to say, the literature tells us that anywhere from 30 to 40% of people are lingering based on the population, like SSDI and workers' comp and personal injury, right? And that's frustrating. It's frustrating for all of us, right? Because we want to help people, and we don't like people are being dishonest. But the truth is that means 60 to 70% are not, right? So I don't ever immediately go and say someone's malingering. But yeah, you're doing this long enough, you start to go like, yeah, that's baloney. That is not, that symptom's not real. Like that's not, and that's why again it's important that you send people to people who are experienced with this injury.
Okay, great. How about one more question?
Yeah, like I said, I'll stay along as long as people want.
Okay, so this one is about prescriptions for prism glasses. They're seen on a lot of concussion claims. Are they beneficial? Are you aware of any medical literature about them?
And by the way, I see go Wings. Boo, go Blackhawks. Um, yes and no. Okay, so there's a lot of ocular changes post concussion. Okay, so I think that's a valid, line of, and I do send people to specialized optometry. But there has to be oculomotor changes, right? There has to be objective measures. And one time, like a patient I recently wrote a report on, she said that the optometrist said my brain is not working with my eyes, but there's no objective findings at all. And so I don't know why this doctor would say that, just because they're parroting back with the patients. I don't know. But there has to be objective findings. And the literature currently does not support the use of prism glasses in vision therapy. However, big caveat is that if you look at the meta-analysis of these studies, basically what they said is the studies were poorly done. They didn't say it doesn't helpful. They just said we need better studies. So I think it's one of those, again, to keep an open mind about. But I wouldn't be supporting prism glasses unless there was clear objective measures that they needed it. Okay.
Gotcha. Are other unrelated conditions like hypertension and diabetes factored in for consideration when you find out
Always.
someone maybe has a concussion? Okay, that makes sense.
Always. Yeah. I mean, there's always, that's why I think people are surprised that neuropsychologists, we know a lot about other conditions, because our job as neuropsychologists is to understand what can affect cognition and emotion, right? And so hypertension affects cognition, diabetes affects cognition, diabetes affects sleep. Like, we have to understand how other conditions impact the person's symptoms. So yes, it's always a component of it. Like the patient I saw yesterday, as example, she went into the hospital because she said her concussion symptoms had gotten worse. Big red flag: concussion symptoms don't get worse. They can be exacerbated and then calm down, but what she had was, a 9.6 A1C, and she had blood pressure off, like, I forgot the number. So she had never been diagnosed with diabetes, and her blood sugar was like 300 something. So yeah, she was having some visual disturbance,
Oh yeah.
but it wasn't, she's lucky she went. I told her I was really glad she went into the hospital, but it's not concussion, right? So that's my point is, providers have to say to people, like, listen, you're telling me a visual disturbance. I believe you, but that's not how it works in a concussion. But let's look at all these other factors. I cannot tell you how many people who have hypertension, ischemic disease seen on MRI, blah, 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 and they're like, it's a concussion. You're like, no, it's your 30 years of untreated hypertension and you're smoking and all these other things that we beg you not to do, right? That are affecting your brain. And those are important. And because ultimately we all just want people to get the right treatment, right? I mean, that's what we want for our patients. But we do need to distinguish between what's concussion and what's not.
So along that same vein, I'm seeing that a lot of claimants with underlying health conditions, they end up on a brain injury rehab program. Is that beneficial?
No, I can't say this enough.
Wow.
Because from a psychological standpoint, okay. So let me put a caveat to that. Okay. It depends. Now, if their brain injury program is because that particular program has a good vestibular therapist or a good social worker or somebody who's experienced, awesome. The problem is, and we see this in Chicago, is that the brain injury programs are so important. I did that work. I used to work in severe traumatic brain injury. That was my early days of training, and oh my God, those people are so important. All those clinicians, and so what happens is people take that sort of program, PT, OT, speech, vocational rehab, all those things, and they just apply it to concussion. And what we see is that people do very poorly because they start to see themselves as brain injured, right? Yes, they had a brain injury, but a concussion is a transient injury. So they see themselves as permanently brain damaged, like the people in the program, okay? And so that's a huge problem. So I really, really don't want people to do that. Again, I want them to get the right treatment, of course, but psychologically, that is not in their best interest to go to those programs.
That makes sense. Um, can you give any advice for someone that would need to approach a neurologist that recommends a patient be withheld from work for over 3 months due to a concussion? What could
So
you?
I would ask that, again, politely and professionally, right? The basis for that decision. What are the concerns that somebody is having, and what symptoms is that person presenting that is incongruent with their job responsibilities, right? And if they're simple, like, well, they have symptoms. Well, yes, symptoms, are not a reason to keep someone out of work. What what are they basing that on? And there could be a very valid reason. Okay.
Hmm.
I will tell you in my experience, and that's probably what most you see as well, is that it's often, well, you filled out a checklist, you came in, I did a quick neuro exam, you're still having symptoms. Okay, you're out of work until your next appointment, which is 3 months. Right. And so that's just like people get on this treadmill. And I feel really bad for patients because they're like, okay, what, and so the answer to the question would be, what is the reason that somebody, what are the symptoms that person is having that based on their work responsibilities that they are unable to do? And again, maybe it's legitimate. I always say, like, used to see a lot of Chicago police officers. If you're carrying a firearm, I want you to stay straight. So I'm not going to send you back until you're recovered, right? So there are absolutely very legitimate reasons. But the other issue too is why 3 months? Like, do you have some kind of magic crystal ball? I don't. I base it on symptoms and managing symptoms and increasing exertional levels as tolerated, right? Because symptom activities. So why would I ever give a particular date? That makes no sense.
Yeah, that's fair. That's fair. How long should an employee treat for a concussion before they should be referred to a specialist?
So, again, I always sort of say, like, we let Mother Nature do its thing, right? Like, I give it 2 or 3 weeks. Remember, the vast majority of people are going to be recovered in that time. Okay. I'm all dealing with that 15 and 20% that are not, which is, it may seem like it feels like 90%, but the truth is millions of concussions happen every year, like, and anywhere from like 1.5 to 4 million a year. So there's a lot of people who are, normally recovering, right? So, if they're not recovering within the first, after the first couple of weeks, you're not seeing them getting better, then they should be seen by a specialist. And honestly, like, I love to see people when the injury is just a couple of days old because, like, we get on it, right? But that's just not always possible.
Can convergence insufficiency be caused by concussive injury? That was actually asked a couple times.
Yeah, it can. Absolutely. Okay. But it can be pre-existing, it can be for other reasons, right? So convergence insufficiency is pretty easy to measure, but it's also kind of subjective because what you do is you bring something towards your face, and what you're looking for is the eyes to converge. And you're asked, people are asked when they see like two pens or whatever. And at some point, everyone can see two pens because your eyes are crossing, or most people do. And so that's also another sort of indications of malingering is I saw somebody recently who said that in the PT notes it said that the convergence was like farther than the person's arm. Well, that meant everything that you see is blurry, okay? But you're not reporting that. You're not walking into walls. So that doesn't make sense, right? So we know that there's sort of normal convergence, but yes, it can be secondary to concussion, but it's also easy to treat.
Is it common for a claimant to lose their vision if they have a concussion?
So when you say lose their vision, these are one of those questions that I always ask when people say that. I was like, tell me what you mean. So it's not at all uncommon for people's vision to go black. Okay, particularly you hit the back of their head. That's the visual cortex. You hit it, boom, you get this black. So that's not uncommon. Would be very uncommon if someone's like, yeah, I'm just walking around, everything goes black. Yes, I would be worried about something else going on if that was occurring.
Yeah, I think she's referring to like the vision degrading over time.
Um, yeah. So again, sometimes that's age. As somebody who knows, my glasses are getting stronger and stronger. So that's the other thing. Like, we see this all the time. Oh, I went to see my doctor and my prescription has changed. I'm like, okay, you're in your 50s. Yep. Okay. And so we want to be careful that we're, again, not attributing that to concussion. So you have to ask a lot of questions. That's what I'm saying. Like, you got to get people who are experienced because you got to ask a lot of questions. Because sometimes, when they see somebody for 10 minutes, they're just not asking the questions. They go, oh, vision changes. Okay. You got to get a better understanding of what exactly they're talking about.
Okay, one more question for you.
Yeah.
Have you heard of someone getting functional neurological dysfunction from a concussion?
So functional neurologic disorder, yes. Okay. And this is the rub, okay, is that we know that people who develop functional neurologic disorder have a pre-existing trauma or something in their lives that make them fragile is not the right word, but predisposed to this, right? But workers' comp is on the hook because had it not been for this accident, they wouldn't be here, right? So there's a pre-existing component, but yes, people can absolutely develop functional neurologic disorder from a concussion. But that's why it's super, super, super important that we're educating people early on, so that when they start to say things like, like this patient I had recently who I diagnosed with functional neurologic disorder, she says, I'm having trouble saying my S's. She didn't. An entire hour-long conversation, she didn't have it. But, that's not, a concussion doesn't do that. Doesn't, and stuttering, by the way, stuttering is another one. Concussion doesn't cause stuttering. So you have to ask a
Interesting.
lot of questions about that, because people use that word for a lot of things. I'm like, what do you mean? Oftentimes when people are talking about stuttering, what they really mean is word finding problems. Like they're searching for a word, which can be in the acute stages after concussion quite common, right? And also, as we said, a very common complaint among adults. My sister always says that thingy, that thingy. So yeah. So it's but when people are stuttering, you almost always hear it, like it comes and goes in interviews, right? They will stutter and then they don't, and then So but I will tell you again, concussion will not cause a stutter.
It's more of a memory thing for the word finding,
No,
right?
it's not. It's a psychological response, stuttering. But that's what I'm saying. If it's a true stutter in that they're demonstrating it for you, like it's always amazing. They'll say they're talking normal and then they're like, I have a stutter sometimes, right? Like it's like it comes and goes, all right, which is not how stuttering works. The language processing disorder. And but oftentimes when people say stuttering, I'll say, tell me what you mean. Like, how does that present itself? And then they'll talk about, well, and what becomes apparent is they're actually talking about word finding problems. Okay, not a stutter. But when it's a stutter, meaning language production, that's a psychological manifestation. That is, a concussion doesn't cause a stutter. And that's been studied.
Gotcha. Well, this was another amazing session. Thank you so much for your time today. And of course, going 15 minutes over and answering everyone's questions. This was really great.
Oh, my
Um,
pleasure. My
Lots of
pleasure.
good feedback also, people loving it. And we're all just so thankful for you.